Hey guys, welcome to the channel. My name is Nick. I am a neurology resident. Today I wanted to make a video on why you should not choose neurology. I think when choosing a specialty, it's important to know some reasons why someone might not like that specialty. So for me, I knew that I wanted to do neurology, and there were certain things about neurology that I really liked and enjoyed. So I wanted to make this video for anyone out there that might be choosing neurology or deciding like, hey, what are the parts of neurology that I might not like and might not want to do this as a career? The number one thing that you should not go into neurology if you do not like taking a history. Most of the time in the ER, when we're consulted, neurology, at least where I train, we get the most history. So we're having to like dig deep into the history, into the chart review, and that takes a lot of time. It's not a quick thing to do, and the recommendations that we give is really based on that history taking. So like one example would be altered mental status. If we're consulted on altered mental status, we have to know what the patient's baseline is. We have to know what they do at home. We have to know if they've done this before, why have they been altered before. So it really requires a lot of history taking. Same thing with patients coming in with breakthrough seizure, right? We have to know what medications they're on, where they're treated for their epilepsy. Are they taking their medications? Has this happened before? So there are so many things in neurology where the history is crucial and the recommendations follow suit with the history. So if you do not like taking a history, I recommend neurology. It's probably not the right field for you. Same thing goes with making diagnosis, right? So if you're making a diagnosis of, let's give an example of headache, right? You need to take a very thorough history to find out what exactly the patient has, what the diagnosis is. Same thing with movement disorders. If you're making a diagnosis of Parkinson's, you need to know the progression, what's changed, what are the symptoms. So a lot of history taking involved. I would say the second thing that you have to enjoy, and if you don't like doing this, then you should probably not go into neurology, is the neuro exam, right? So I can't tell you in my residency how many times I have done a neuro exam, and that is the basis of neurology, right? We can't localize a lesion, we can't make assessments without our exam. That's why every note has the neuro exam. At times it can get pretty tedious, and you don't have to love every aspect of it, but you do have to like doing the exam because that's going to be a bulk of what you do on your daily life. So if there's a stroke code coming in, you're doing a neuro exam, you're doing a quick neuro exam. If they consult you in the ER for something, you're doing a full neuro exam. So that includes like mental status, cranial nerves, motor exam, sensory, cerebellar testing, gait, looking at their gait. This is also pretty intensive and you get much quicker at it, but it's something that you have to like and enjoy if you're going to go into this field. The third thing I would say would be stroke. You have to appreciate stroke at least, or at least be willing to help stroke patients. The bulk of inpatient neurology is stroke. I mean, at my center, but I think a lot of neuro residents would attest that stroke is so common, right? It's something that we see all the time. So if you don't want to deal with patients that have stroke, at least in your training, neurology is probably not the field for you. I know for me, when I graduate training, I probably won't have a lot of stroke patients, but I still learned a ton of stroke residency, and it's super important. I think the same goes for epilepsy. I've seen a lot of seizure patients in my career so far, and I think if you don't like seizures at all and you want to avoid that, then neurology is probably not for you because it's pretty common and we see it a lot. I would say that another thing would be why you shouldn't maybe stay away from neurology, and what might make people want to stay away is that we kind of have two intern years. So you have your first year, which is a lot of medicine. I think it's 8 months of medicine that you have to do, which is a lot. I did more inpatient medicine than many of the PGY2 medicine residents had done at that point because we did so much floors, so much medicine floors. And then when you start neurology, right, you're basically doing kind of an intern year again. You're a neuro junior. You don't really know what you're doing, and you have a senior, and you're kind of learning the field of neurology. So it feels like 2 intern years, which some people might not like. And it's a 4-year program, right? Neuro Residency, which is much longer than 3 years. Even though it's 1 extra year, it's a lot longer. So some people might not like doing that extra year. I guess another thing that might deter you away from neurology is if you really, really love procedures. Sure, if you go into neuro, like you do neuro IR, you do procedures. You do go into pain management from neurology, you do procedures. Yeah, we do lumbar punctures. Yeah, we do some Botox injections, some trigger points and stuff, but it's not a very procedure heavy field. You can go into fellowships like EMG, where you're doing EMGs and movement disorders and headache where you're working with Botox, and pain management where you're doing procedures, and neuro IR where you can do procedures. But I'd say overall, compared to like other specialties, this is less procedural. So we can compare it to like on medicine. If you want to go into GI, you do a ton of procedures with GI, right? So it's different in that case. But what the fellowship you choose can open up that procedure door for you. Kind of the last thing as to why someone should stay away from neurology is if you really do not like neuroanatomy. I wouldn't say that you have to love neuroanatomy to go into this field and like really want to study every little pathway, but I think it should be somewhat of an interest to you, and you should find it interesting and fascinating. And I think that if you do not find the nervous system as the most fascinating organ system, then neurology is probably not the field for you. So just some reasons why not to go into neurology. I hope this helps. I hope this helps people that are deciding if they want to go into neuro, or deciding between neurology and something else. And maybe this video, you're like, hey, I don't really mind any of that stuff, then maybe neurology is the field for you. So thanks so much for watching, guys. I really appreciate it. If you like what you see, subscribe, and I'll see you in the next video.